Oh, I hope I'm doing this right. Admit. Hi.
Hi, how are you?
I'm great. How are you?
Good. You must be Odessa.
I am Odessa. Nice
I'm
meeting
Laura
you,
Vander.
Vander Molen. And I saw today that it's two names. I was trying to mesh them to trying to put them together, Vander Molen as one. But it's nice meeting you.
Yeah, nice meeting
Yeah.
you.
Yeah, we're just waiting on one other person. We're waiting on Desiree.
Okay.
Um, from Core will help. We'll give her a few minutes to hop on. And just bear with me because this is only my second time doing this. And I'm hoping that um, I'm doing this the right way. I'm hoping
No
that I'm doing
worries.
it to where um, it's going to be streamed on Facebook. But we will
So I'm gonna
see.
just play around here for a minute because I answered some of your questions and I'm gonna see if I can have that pulled up somewhere where I can see it
Okay. All
and
right.
see you, which I never know if I can do.
Okay. Just waiting.
So now, I saw this is like Odessa's Health. Tell me a little bit about how you're doing this and
Well, I started during the pandemic. Just started with wellness maybe almost 20 years ago. I
okay.
lost my father to, um, I mean, there was a number of things. He had a massive heart attack, like maybe 18 years ago. And that really just kind of catapulted me into wanting to um, do better for my family, for my kids, my husband at the time. And that just kind of started the whole wellness. And during the pandemic, I had all this free time. And I was like, you know what? I've been training people as a personal trainer. I've been helping people with their nutrition. Let me do a little bit more.
Oh,
Um,
wow.
and then Wellness with Odessa Online started. And last year, I started Boston Square Wellness Collective. It is
Okay.
located at 1213 Kalamazoo Street, and it is a space where the BIPOC community can gather to practice movement through yoga, Pilates, strength training, which is very important, and just
I'm
learn.
drinking Pellegrino because I just came from my exercise class. In fact, I
Oh,
had an
really?
exercise shirt on, and my husband said, "You're not going to take that meeting looking like that."
Oh my
But I
gosh.
quickly changed just for you.
Just for me. Oh wow. Let me see. Has entered to the room. admit. Let's see if I'm doing this right.
I'm actually going to throw a cat down in the basement so she stops scratching.
Okay. All right.
Go.
Uh, let me just, I'm going to shoot a text to, okay. Oh, she's having difficulties joining, but I'm trying to join as we speak. Okay. Unmute. Let's see. Just okay. Waiting room. Okay, wait. Admit here. Desiree and Desiree. Oh, I just admitted to you. Let's see. Just okay. Well, oh, what is this? Hi.
Hello.
Hi, Desiree. How are you?
Good. How are you?
Good, 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 good. So happy to have you guys on with me. Desiree, I have Dr. Vander Molen of Exalta Health joining us. Dr. Molen, Vander Molen, I have Desiree Hayes of Corewell Health. So thank you guys so much. I was just explaining to Dr. Vander Molen um, why I started Wellness with Odessa, Wellness Wednesday. And I was just telling her that my father passed away some years ago from a heart attack, and a massive heart attack. And he had other complications as well, diabetes, overweight. And it just kind of really sparked something in me to want to do better and learn and teach people on the importance of taking care of ourselves, especially Black and Brown community. I'm going to give you guys a chance to introduce yourselves. Dr. Vandermolen, we'll start with you. Tell us, who you are, where you're, what organization or business you are affiliated with, and we'll get started.
All right. I'm Laura Vandermolen. I'm a DO, and I am the medical director at Exalta Health, which is a clinic, medical and dental. We also have behavioral health for mainly underinsured and uninsured. We have a very small amount of Medicaid. So for our percentages, like only 15 to 20% are Medicaid, the rest are uninsured and underinsured. So they pay along a sliding scale. We
Mhm.
have a very large Latino population. Most of our staff are bilingual, many of them bilingual, bicultural. We also do quite a bit of refugee care. And then we're located right on division between Alger and Andre. So we also have a
Oh,
growing
okay.
population of African Americans.
Great. Um, Desiree, introduce yourself.
I'm Desiree. I am a nurse care manager with Corewell Health, Healthier Communities, a program called More Life Más Vida. I've been here for about like a year and a couple months. And basically what we do, we're free. We offer free service to the Hispanic and Black population, mostly for like uninsured or honestly, anybody, but we focus more on the Black and Brown community, and we do prevention of cardiovascular disease and diabetes
Oh,
prevention.
wow.
So I do a biometric screening that checks for blood pressure, lipid, blood glucose, BMI, body fat percentage. And based off of those numbers, I will do health education, as well as goal setting. And then they also have community health workers that help with resources around SDOH needs that they might have that's preventing them from focusing on their health. And I've been a nurse for 2 years now, as
Oh,
I believe the sixth. So yeah.
okay. Oh, wow. Well,
Congratulations.
congratulations.
So this is
Um,
kind of fun. We actually have a lot of Mas Vida More Life people who will come with their biometrics to us. Once
Okay.
they, like I just actually this week had a new diabetic who was found through Mas Vida More Life.
Awesome.
She brought her, they bring their little peeper in and her hemoglobin A1C was over 7. So
so the biometrics, for our audience, exactly what is that?
So biometric screen is me checking for blood pressure, HDL, which is good cholesterol, LDL, which is bad cholesterol, glucose, A1C, if their fasting blood glucose was elevated, um, and basically a metrics of different things, as well as BMI and body fat percentage.
Okay. All right. All right. Well, let's just dive into this. I sent you guys some questions ahead of time, just to give you. I mean, I know that you guys are experts in what you do, but just wanted to shoot some questions so you guys know exactly what we would be talking about and the questions I'd be asking. I just want to start with the first question I sent to you guys was. Well, I don't even know if I sent this one, maybe not. So I'm just gonna throw this on you. Um, when someone has been diagnosed with heart disease, exactly what are they been told? Like, what is heart disease? Does that make sense? Like, when you say, "Hey, you have a heart disease," we're diagnosing you with heart disease. What are you telling the patient exactly? Like, break it down for us, please,
So I
Dr.
think that
Vander.
is a very general term. I think most people, when we're talking about it in this setting, is we're talking about coronary vascular disease or arthroscopic disease with plaque buildup in arteries and it can be of the heart or of the arteries like to the brain, like carotid disease. So atherosclerotic disease is kind of what we say when we generally talk about heart disease, I think. And that's the heart disease that will cause a heart attack.
Okay.
That's that disease process. It's the disease process that it's multifactorial. So people who have family histories have greater risk. People who have elevated cholesterol, particularly that LDL. People who have overall body inflammation, and
Mm.
then if you smoke or have diabetes or high blood pressure, it increases your risks. And if you have poor exercise capacity, you have increased risk. So I think that's the cardiovascular disease most of us think of when we say heart disease.
So now I'm learning that there are a number, when you talk a heart disease, there are different heart disease. Okay. All right. Um, did you want to add to that, Desiree?
She pretty
And you guys are the experts. I really don't know too much about heart health. So you guys I am learning just as the audience is learning. Did you want to add to that?
She basically summed it up. Is either a disease that affecting directly the heart, or like she said, arteries with the buildup plaque, that could result in like stroke, um,
Oh,
and
yeah.
myocardial infraction, which is same thing,
Yeah,
um,
yeah.
heart attack.
Okay. All right.
I'm sure like Desiree will probably see it too when I think you take care of people who have heart failure, right, Desiree, with Masvita More Life, or
Mosquito,
the
we do
or is that
prevention.
more
Um,
with prevention? It would probably be your it used to be Core Health. I think they just changed their name.
Start now. They
Yeah.
management of diabetes, heart failure, and COPD.
So heart failure is another heart disease that you'll hear that can be caused by untreated high blood pressure over years
Oh, wow.
or
Oh, wow.
heart attacks. So that's another kind of heart disease that people will think of, and that affects particularly the African American or Black community more than some of the other communities.
When someone is diagnosed with heart failure, how long, I mean, is it a death sentence? Can that diagnosis be reversed or?
Um, it always depends on how bad it is when they find it. But yes, it can be treated for a long time, and sometimes with meds, especially if you lower people's blood pressure, they can do well for years.
Okay, all right. Okay, moving right along because I know we don't have a lot of time. It's moving pretty fast. What are some of the statistics regarding heart disease prevalence and mortality rates within the Black and Brown communities? Can you give us some? Can you guys give us some statistics?
So according to American Heart Association, not 80% of Hispanic adults in the US are overweight or have obesity. And then among the Hispanic men, they're the second highest death rate from stroke.
Oh wow! Oh wow! All this time I thought that, and I mean, I could be wrong, but I thought that African American um, experienced heart failure or heart disease or were diagnosed more. But
They're still the high. So I think in American Heart, we all love the American Heart Association because they have great statistics. So Desiree and I are probably on the same page. So the cardiovascular disease, so that a heart attack causing disease we talked about, the mortality
mhm.
rate is highest among non-Hispanic Black people compared to other racial and ethnic groups. But I think obesity may be a little bit higher in the Hispanic population. I think that's what you were saying, Desiree, too.
Yeah.
It sounds like there are other causes, like other illnesses that play a part in heart disease. Like I was telling you guys earlier that my dad, he died from a heart disease, from heart failure, heart attack, but he also had diabetes and high blood pressure, and he was overweight, and so yeah, there's a lot. It seems like there's a lot that plays into it.
So the diabetes and the hypertension really do play a part in increasing your risk for cardiovascular disease because it's a problem with the metabolism of how you use and um, I would say probably handle your cholesterol. So most diabetics type 2s will have high cholesterol and more inflammation. And so that again increases the risk for a cardiovascular heart disease.
That's true. Um, Next question is, what are the most common symptoms of heart disease that individuals in the Black and Brown communities, or anyone for that matter, should be aware of? Like, what are the signs if you're feeling pain in your chest? I don't know. I know sometimes people say you may feel a subtle pain in your arm. Um, that means that you could be experiencing a heart attack or
So for,
something related to that.
oh, sorry. So hypertension may cause the silent killer because of that.
We can't hear you, hun.
Let me turn this
Okay.
up.
Okay.
All right, can you hear me better now?
Yes.
Okay. So I was saying with hypertension, they call it the silent killer because a lot of times you don't have immediate symptoms. But over time, once the disease progressed, you might have like shortness of breath or chest pain. Also pain, you might have radiating pain in your neck and jaw area. Um, People might experience numbness and tingling in the legs or feet. Uh,
Mm.
so those are
Um,
the main
I would
symptoms.
say, yeah, I think for a classic heart attack, we usually think of that something sitting on your chest, shortness of breath with it, you feel sweaty.
mm,
For women in particular, they will get more nausea and kind of like indigestion and a weird feeling more. A lot of times they'll describe it kind of in the mouth of their stomach, right under your ribs. So I
oh,
think that's when you need to be aware that particularly women and diabetics don't always have that classic, oh, something's sitting on my, something sitting on my chest. They'll have more of a really unwell feeling, nausea, maybe pain in their arm or their neck, and
mm.
feeling short of breath and sweaty.
And then when you have those symptoms, could it be something else, or do you guys suggest if you have those symptoms, get to the hospital, get to the doctor ASAP?
I would say, especially if you're short of breath and you feel like, you're like, most people will say they have that feeling of something's really wrong. You should
Mhm.
go directly to the ER if you feel that way. Especially if you have diabetes or hypertension.
Got you. Thank you. Thank you. Moving right along. And guys, I just wrote these down. Like I said, this is so new to me. So please just bear with me. I'm just like, how can I ask these questions um, so that I'm asking effectively? Um, I think the next question I have for you guys are prevention. Like, what are some effective prevention strategies for reducing the risk of heart disease? I think we probably kind of talked a little bit about it when we talked about, I think maybe Dr. Vander Molen was talking about exercising and what we eat and like prevention.
So physical activity, I tend to tell my participants to aim for that 150 minutes of moderate intensity exercise per week. Uh, I also educate them on aiming for like 5 servings of fruits and vegetables per day, including grains, fiber, protein in their
Mm.
diet, limiting that saturated fat and trans fat because that is what builds up in the arteries and creates that excess plaque, and choose more healthier fats.
I think that is one of the biggest things for people. One of the biggest obstacle is the eating
Mhm.
better, especially in our community, because a lot of times we don't have access to healthier to healthy foods, so we tend to eat a lot of processed
Mhm.
food. I know for early on growing up in Mississippi, just really just trying to get by. I remember my parents just trying to get by. You eat what I did have access to a lot of healthy foods, like because we had gardens. But by the time we added in the bacon and the lard, it it was no good. So that is one of the biggest thing. As a person who works out, who watches what I eat, and with my clients, that is so huge, so huge. Just eating better. And you don't even have to
Mhm.
start eliminating everything. You just take a little bit at a time and start to change your way of eating.
The other thing I think is making sure people aren't smoking.
Hmm.
Um, Sleeping, getting good rest, they have actually found to be helpful. And then if you do have diabetes or hypertension, really treating those.
Gotcha. Gotcha. And so we have a few more minutes here. Let me get to the next question. So we've talked about the prevention, eating better, fitness, getting in your exercise, and what did you say about smoking? Um, do you tell people just to stop completely, or try to wean yourself off over
So
time?
I mean, our goal is to have people not smoke. There are medical treatments that can help, but if someone's like, I'm really struggling, even just cutting down is a good place to start. But our goal will always be at some point to try to get you to quit.
It's a nasty habit, unhealthy
But
too.
very difficult to quit.
Um, Are there any specific resources, programs available to support heart health within the Black and Brown communities? I think the question was in America, but maybe right here in Grand Rapids. Are there any resources, any place people could go to get more information on heart health?
So More Life Más Vida is of course one, and it's free. Start Now is also another one, as well as like clinics, Exalta Health, Cherry Health, as far as when it comes to medical. And then there's also a free medical clinic called Oasis of Hope, and
Okay.
they offer free services for people who qualify with income for the uninsured. Um, and as far as like for resources like Urban League, um, Baxter Community Center, to kind of help with those SDOH needs that might be preventing somebody from focusing on their health.
Thank you. Thank you. Are these the first place that you mentioned? What was the name of that again?
More life,
Um, what was that?
more life, Mosquito.
Yeah, where is that located?
So we are located on Granville Street, between Hall and Clyde Park. But right now that street is tore up. So we are seeing people out of our Seward location, which is 665 Seward Street. And that
Okay, that's
street,
downtown. Isn't that downtown? Located downtown? Okay.
it's off Bridge Street, around 5th or 6th Street.
Okay. All right.
So Grand Rapids African Health Institute, GRAHI,
Yes.
GRAHI, and they have some stuff. And then online, there's the American Heart Association has a lot of good information about heart healthy diets, lots of different stuff that they will have on their website.
Okay. Shout out to Grahai for connecting us. I just wanted to give out shout out to the Grand Rapids African American Health Institute for connecting me with Dr. Vander Molen of Exalta Health. I was so excited when they connected us. And I think I have one more question. And then you guys, if you want to just share a little bit more, you have some other tips or information around the heart health disease, feel free to share that with us. How can cultural factors and socioeconomic disparities impact access to healthcare and heart disease outcome in the communities, in our community?
So those social determinants of health are big contribute to developing those type of diseases, due to maybe lack of financial resources, which relates to not having money for insurance, not knowing resources within the community that offers those free services as well. Maybe lack of access to healthy foods. Also low income, people who are unemployed as well, might not have those same access to services as other races and ethnicities.
Hmm. Hmm. And I think a lot of times too, it is a fear, not trusting anybody like in the medical field. I have a lot of relatives who suffer from high blood pressure, diabetes, and probably heart disease as well. And it is, I find that trusting doctors, trusting people in the um, wellness and health community is or industry is it's really really hard for people of color to put that trust in someone.
Well, and that's not only historical. I mean, we've also shown when they look at studies that medical care hasn't been given the same way at times. And so there's a reason for that fear. So,
Right.
we need to do better, but I think the other issue is like Desiree said, like with high blood pressure, people don't necessarily feel bad. Same with diabetics. You can have high sugars for a long time and not feel bad. And so
Mhm.
then they it's really hard for them to understand that although they may not feel bad, that disease is devastating parts of their body as time goes by. And so I think educating and having, providers who can, if it's Spanish speaking people or English people, or just taking the time to really explain the disease process, because I believe most people can understand it. If you say, look, if you have a pipe that's really tight and you have to push blood through that thing. What's going to
Ooh.
happen to that muscle? It's just going to work too hard over
Mhm.
time. But, sometimes I think sometimes we don't take the time or aren't given the time with some of the way we're supposed to be seeing people to kind of explain to them the disease process, which then I think sometimes they can catch it. And, it just takes time. It takes time to build trust, just as you said. It takes, repeated
Yeah.
visits of being there.
Yeah. Hopefully more talks like this right here
Hmm.
will just, be a space where people can come and just
Yeah.
share and just try to change the narrative around heart disease, high blood pressure, diabetes, all of those things that plague the Black and Brown communities. What about children? Do you guys come in contact, or do you guys see a lot of children, a lot of teens um, that have been diagnosed with heart disease, some form of heart disease? Do you guys see what are those numbers like?
I don't, so usually when you're thinking about the heart disease that causes heart attacks, it's usually going to happen older. Now we do have it occasionally happen in young people, 40s years old. But I think what my goal for kids is we got to keep them active. Those lifestyle changes that we are doing to older people really need to be done in the youth, because
Mhm.
um, that's when some of that disease is starting to occur. The plaque being laid down, we know that. So, um, trying to encourage middle schoolers who hate to move unless they're in sports, we need to get them active and outside and being healthy, eating
Mhm.
healthy, trying to teach them not to eat all processed food. And again, that can be really tough cost wise. I have a 13-year-old boy who eats me out of house and home. It's really hard to keep healthy snacks. It's like,
Yes,
just go get a Pop-Tart, I mean,
right.
I think, but those are when those habits form.
So we
So
really need to be starting with our
young,
youth,
yeah.
you
In
know.
fact, I think sometimes it needs to be thought of as like a family thing. Like, how do we make
Wait,
our family healthier?
yes, I so agree. And it's a hard thing, but I tell you from experience, if I always say to people, if you don't buy it, and I know because we've talked about the disparities, and sometimes people just don't have the finances, and I've been there, where I was on food stamps or getting assistance. But what I found was it was doable. I just started with a few things, like we're not going to have pop. I know these kids like pop, but I'm in charge here. I'm just not going to buy it. And eventually, now my kids hardly, especially my girls, they didn't grow up drinking pop. So it's not really a thing for them. So we do really need to catch that early on if we want to start to see, I believe, changes in the community as it relates to these illnesses. So,
I know,
is there anything else that you guys would like to add? Some more,
I
some.
would say specific. I know we're almost out of time or out of time, but I think you hit something really important about the African American diet. It actually has a lot of historically very healthy things. We just may need to change how we cook them a little bit. But
There you go.
I
Yeah.
think that, I think of stuff like okra, green beans, collard greens, all of those are
Oh,
very high in
right.
a lot of great nutrition. And so, maybe we try to cook them slightly different, but they're still delicious. And, I think that's the other thing, is not to see everything that we consider culturally appropriate. Some of it's just changing a little bit how we make it.
Changing, maybe
know,
with
um,
instead of adding bacon or lard or
Olive oil,
um, you know, olive
yeah.
oil, smoked turkey
Mhm.
neck. I have my mom using that now, and it has so
Yeah.
much flavor. Um, yeah, we could still eat, and we still do. Our family, we still eat the foods that we like. I just found uh, ways to eat it a little bit healthier.
Mhm.
I still have my cornbread, but I cook it a little bit differently. So yeah,
Right.
we can do this. We can do this.
Yep.
And also,
Desiree, is there anything else you wanted to add?
yeah, so lifestyle medicine is a good resource as far as healthy cooking. They do their classes at the downtown market. They have family kitchen, which incorporates both parents and children, teaching them how to cook healthy meals, limiting the sodium and focusing on more of the other spices to give it flavor.
What is that called again?
Lifestyle.
Lifestyle, lifestyle medicine. You have to connect. Oh, wow, 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 wow. I think we touched on a lot in this short little time here. I really would like to thank you guys so much for taking the time to speak with me, to have this discussion. You guys gave some very valuable information, and I'm hoping that the audience, those that are watching, that will watch, can get something out of this right here. Thank you guys so much. I appreciate you guys for joining me.
Thanks for inviting me. I enjoyed
Yeah,
it.
thank you. Thank you, Desiree.
Thank you. I
All right.
appreciate it.
Thank you guys for joining us. It's been fun. Stay tuned for the next Wellness Wednesday, hopefully in a couple of weeks. I want to start doing this every 2 weeks. So bear with me. We're getting it together. I appreciate you guys. I appreciate you, audience, for um, joining us. And yeah. All right. Bye-bye.
Bye.
Got to get out of here.